Excuse me, a little privacy please, thank you. Yo, it's National Breastfeeding Awareness Month. I know you've been waiting all year, but it's finally here. So that means we're gonna uncover those other covers and talk about the other use of the word, nursing. Now, if you like the idea of a nurse devoting his time away from his job to help you live a better life, go ahead and hit that subscribe button down there and the little bell next to it. Or if you're not watching this on YouTube, go there and make it happen. Because whether or not you know it, I care about you. Just like I care about every patient I sit down next to. So you deliver on your side and subscribe to me, and I'll deliver what I got on mine. Deal? Let's jump right in. Now, nipple tenderness aside, this can be a very sensitive topic. So I want you to know if you have any strong religious, cultural, or any kind of belief against breastfeeding, then you do you, boo-boo. But I'm here to give you an easy way to remember the possible benefits of breastfeeding, based on studies, research, data, and all the shit I sifted through so you didn't have to, with this simple mnemonic. A, B, C, D, E, F, G, H, I think I might breastfeed. Thank you, you're too kind. I'm here all week. Okay, the A is for allergies and immunity. That boob juice is more than just milk. It's an immunologically active substance, meaning it's got antibacterial enzymes, anti-inflammatory properties, cells that fight infection, all sorts of goodies that could help your little love bug fight off all the gunk that's in our world. Next up is B for bite. Studies have shown that breastfeeding most likely reduces the chance of malocclusion, which is bad alignment of your teeth or jaw. Trying to correct that years down the line might require jaw wiring, surgery, or braces. That's risky or expensive things which fortunately I wouldn't know anything about. Next up is C, and that's for cancer. Okay, yes, the big C that no one wants to see. Okay, moms, you could reduce your risk of ovarian, endometrial, and breast cancer all through breastfeeding. That should be enough right there, but if it ain't, your baby might appreciate you maybe lowering the risks of childhood cancers like leukemia, lymphoma. Cancer is one of the worst things in our world that has affected almost everyone in one way or another, and there's some promising research out there that I suggest you explore. The D is for developmental. Visual function, hearing ability, behavior, cognitive development, basically everything you want them to get a passing score in. Even the slightest bit of research suggesting this, I take my bra off right now and get it started. If I could only get the... I've done this at least 3 times. E is for economical. Breastfeeding is free. The powers that be essentially have mind control over most of us, so if they really wanted you to spend money on that first year postpartum, they'd scare you into doing it. But no, extremely reputable organizations like the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and the World Health Organization are recommending that you pocket the money you'd be spending on formula and use what you were born to use. The average savings of breastfeeding a child is about $1,000 a year. $1,000! That's like 8 years of Netflix. That's like 230 pumpkin spice lattes for you, girl. Treat yourself. The F is for functionality, and this one's for you, mom. Getting you back to who you was before you could barely walk, got depressed, and started eating for 2, and sometimes 3. So when you breastfeed, you secrete oxytocin, prolactin, and neuroendocrine peptides, okay? All these speed up the recovery process and can help you deal with the stressors that come along with being responsible for a brand new human being every moment of your life from now on. Studies have also shown less child neglect and abuse and an increase in mother-baby bonding. How sweet is that? Okay, I'm guessing half of y'all are thinking, yeah, what about this amorphic figure that used to get my partner all hot and bothered? Well, if you haven't guessed it, studies have shown that postpartum weight loss increases with breastfeeding and good nutrition and exercise. The G is for gastrointestinal, and that means everything from their lips to their shits. Your milk can work wonders on their GI tract in way too many ways for me to go through in this video, but one that's really worth mentioning is the decreased risk of NEC, or necrotizing enterocolitis in premature infants, which is the disease of the intestines that causes the bowel linings to perforate and stool to empty out into the baby's gut. This can cause serious complications, including death, and is one of the most common GI emergencies in the neonatal ICU. The H is for human milk, and this is just to remind you that breastfeeding is only human. And dogs. And cows. My point is that it's natural. Now, I had a patient once tell me that breastfeeding is weird and gross, which 1 made me think she's never seen anything on the internet, and 2 made me think about our f***ed up cultural norms, and I kind of understood where she was coming from. But think about it. Is donating blood gross? You could save a life. Is swapping saliva when you're making out gross? Maybe, but either they're hot or you love them, so it. My point is, our bodies are made up of unbelievably complex designs, and one of those designs is to naturally nourish your child extremely effectively. Think about taking advantage of it. Plus, there's all sorts of products out there specifically designed to make breastfeeding more easily and sometimes fashionably integrated into your uniquely developed lifestyle. Lastly, the I is for infancy. Remember, infancy covers age 0 to 1 and is widely recommended that you breastfeed for at least 1 full year. The first half exclusively with breast milk, and in that second half, start introducing those solids. A, B, C, D, E, F, G, H, I think you might breastfeed. Now remember, I am in no way telling you not to formula feed your child. Women, it's your body, it's your baby, it's your family, it's your life, it's your choice. I'm just hitting you with info I've learned of that elixir of the gods you got brewing in those breasts. Now, if you want to share your experiences, give advice, or want another video, say tips and tricks for breastfeeding from specialists I know, or any other video for that matter, drop a comment below. Just don't forget to hit that subscribe button and the little bell too. I'm clocking out.